Hi, everyone. My name is Anna Goddard. I am Project Echo faculty for SBIRT and School-Based Health Centers for the School-Based Alliance. And today I was asked to present to everyone on EHR modification and billing and coding considerations for SBIRT as part of the implementation and sustainability of the work in the field. I have no commercial disclosures or conflicts of interest. And so today I want to jump right into this content. With any evidence-based practice implementation, you generally want to consider all of the following. Information technology and electronic health record modification both go hand in hand with the reimbursement for services because you need to adequately document and be able to pull that data to submit a claim for your visit. And so if you want that implementation of practice to be sustainable, you need to make sure you're being reimbursed for those services. So generally, we speak about these two considerations simultaneously. And when you implement any sort of national standards, you want to be able to share your data. But not only share your data, you need to be able to speak to what you performed or implemented with your data. So anyone who is involved with the different facets of healthcare administration where you work, you know that this is required for your grant reporting, your accreditation metrics, your metric standards, and of course, for all of the FQHCs, this is part of your fee schedule and your metric requirements. So having standardized collected data across the field also allows you to show your stakeholders and your value and worth for the school-based health center care that you provide. So you want to be able to, just for an example, you want to be prepared to speak to the same metrics, but also report to your stakeholders, including those financial stakeholders at your own organization on what data they need reported, which is what you first need when you make any sort of EHR modification. So I wanted to share this example. You would never report, for instance, we did SBIRT with 20% of users, or we did SBIRT with 1,000 patients, as this doesn't really appropriately report on the different components delivered of SBIRT, including the screening itself. And so similar to this example here, you want to be able to speak to the components of SBIRT that were delivered. So in this example, a Connecticut State SBIRT grant funded program reported on the number of patients screened, the number of patients with positive or risk factors, but then specific for this purpose and aim of this grant, the number of patients that were referred for treatment services that speak directly back to that purpose, aim, and to the funder. So this is just a higher level recommendation of the minimum data that you're going to look at collecting to report on relevant data in the implementation of SBIRT components. And remember, in your training, you need to define to both your clinician and your IT analyst what each one of these elements mean and where you're going to have clinicians document them, and then where they're going to pull them from the chart. So for example, you might want to clarify the visits with brief intervention refer to motivational interviewing or psychosocial education that is given, and make sure you spell that out both to IT, who's going to pull your data, but also to your clinicians who are going to be documenting that. And then spell out what referral to treatment means. You might want to pull how many teen intervene you're doing or referring to a therapist or treatment center, and then make sure you define what each of these data points mean so that you're speaking the same language between your IT and your clinicians. And then before you make your EHR modifications, we're now getting into more detail from the last slide, but this might be some minimum data you want to collect for analysis on these components. And list, as you can see, is also very sustainable data entry for your providers. This is very straightforward for data extraction too from your IT department, because most of these can be pulled with CPT codes or ICD-10 codes. And then with this list, you're able to more specifically address risk involved with positive substance use, positive depression screens, how many were referred specifically to this list. Which then leads us to the importance of IT or information technology involvement. So during these initial phases of SBIRT implementation, but also in the whole process, this serves as a routine check-in for your sustainability as well, because there needs to be a truth in data. So in other words, to meet your assumption, you need human thought to assure you're saying and reporting what you're actually doing in the field. to be able to generate your EHR reports, which is why you're going to be modifying your EHR system, it's really best if the clinician or your SBIRT champion or your project team lead meet directly with your IT, especially at first, on whoever will be pulling your data. Give them estimates of what you might be expecting to see. Like, I'm expecting to see 100% of these students this week were documented with a PHQ-9, and then make sure when IT goes to pull that you're seeing the same things before you make a permanent EHR modification. Your IT staff will be able to lead you on what best modality for the modification process will be, as they're really not a catch-all across all your different EHR vendors. For example, ECW, which is eClinicalWorks, had different modification processes than Epic, and they have different ones than NextGen. So you need to work with them specifically on how to best capture the data from your EHR. And you're going to want to modify your EHR to incorporate those documented SBIRT services, those components that I just went through, into both your medical and your behavioral health records specific to that vendor. So you'll need to work with them on whether you should build, for example, a smart phrase or a smart form, or just change one of your templates for more ease in charting these components. So this is really a critical step in the process of EHR. Okay, especially for your providers, is to have a provider test the EHR modification functionality and then identify whether or not that modification was successful. You can produce screenshots of the SBIRT in the EHR to review your outputs and your modifications, or you can just run a sample patient through your record and produce a sample report, and that serves as a check and balance system to make sure your system is reflecting exactly what you're intending it to do. So now that you're working with IT and you have your EHR modifications in place, your documentation should be directly supporting your billing and your reimbursement for services, as SBIRT is reimbursable by both commercial and public insurance entities. And the most important component of that billing for SBIRT to understand is that the ICD-10 and CPT codes that your providers enter need to be specific, as they vary depending on your healthcare organization. So you might be entering different codes, whether you're a private nonprofit or you're an FQHC versus a university billing system. So you should be working directly at this point with your billing department prior to your SBIRT implementation or during your initial launch phases to really figure out what codes are reimbursable for your organization and your organization's fee schedule, but also are specific in your state, because not all states have active Medicaid codes for different components of SBIRT. So your CPT and ICD-10 codes will differ slightly, but based on where you're providing your services. And not all states, and you also need to determine upfront if those ICD-10 codes you're utilizing relates to confidentiality, if it falls under substance use confidentiality for your state law, if you're going to be submitting billing claims on them at all, because in some states, billing insurance, commercial insurance will send home an explanation of benefits, or EBB, and you have to consider that on that bill or on that explanation of benefits, they might have listed cannabis use disorder during your coding and your billing, if that's how you're capturing a positive craft, and you might not want that sent home to the parents. So you have to think about that ahead of time on how to work out confidentiality with your adolescents. So this is an example of a reference slide for everyone on the screening codes for the SBIRT process, which also play an important role as data elements, but are also reimbursable depending on your state and your insurance payer. And again, you need to work with your specific agency billing department or a professional coder at your organization to make sure your providers are entering the correct code in your documentation. We also check in with our coder in Connecticut every October 1st. The Medicaid codes are updated. So we check with a professional coder and make sure that these are all still part of our own fee schedule. So this is an example and a reference slide for the coding involved in the screening with brief intervention code. And so in this specific example, the billing codes that account for brief intervention require a 15-minute to be spent administrating and interpreting that full screen and then performing the brief intervention. But this is another way to capture that with your CPT codes. So I wanted to end with just some examples of EHR modifications that will also support your billing. This is an example of a smart phrase put into a progress note that will support the CPT 96160 billing code when a craft is negative and no brief intervention is indicated. So you can modify your EHR to better support your clinicians in their implementation by building this into a smart phrase. And if their patient has negative craft and no brief intervention, they can quickly just pull this right into their note for documentation service purposes that will also support putting in that billing code. And this is another example of a smart phrase that you can build for a positive screen. So this would be a positive craft with a brief intervention. You can also use a template and make sure that this documentation is somewhere in your template that provider can pull in to their note. And this is also an example of how you can support from the last slide, the 99408 code for when the craft is a score above 1, indicating the brief intervention was to be done. So this is an additional reference from SBIRT Oregon. They have a phenomenal website built out, and they also have billing and documentation link here for you to look at in your own time. And this concludes my talk for today. I welcome you to email me if you have any questions, comments, or feedback.